Okay, so we are going to remove staples and sutures. First thing, I'm going to identify myself, identify my patient, provide privacy, safety, body mechanics, gather my supplies, which are here, wash my hands, don gloves, and I'm going to check the chart to see how many staples are there and for how long they've been there and if there's an order to remove them. Once I've done that, then I'm going to tell the patient what we're going to do, and I'm going to assess the wound because, first of all, I'm going to wash it. I'm going to get it clean and assess for any signs of infection, redness, swelling, check the temperature, and if the patient needs to be medicated before, that's fine. If not, then I can remove it. It shouldn't be too painful. So, the way I do it, I grab a hold of the knot and pull it slightly so I can cut the other side as flush to the skin as possible. So once that side is cut, I'm going to pull from the knotted side and take the staple out. I would remove every other one and check the approximation of the wound to see if it's healing properly, and if everything's fine, I can remove them all. Apply the skin prep and stair strips, which are 1/8 of an inch apart. And of course, I have to make sure that they're on the skin prepped area that I prepared. After that, I chart what I did, and before charting, of course, remove my gloves and wash my hands and then chart. Now, for staples, we need the proper equipment, which in this case we're going to use this one. The proper one is the staple remover, which is supposed to have a couple of jaws or feet. And I'm going to do the same thing, assess for signs of infection, clean it, and now I'm ready to do this. I would have a gauze to collect these. And then the way to do it, I got to make sure that they're perpendicular to the skin. And then I insert it and squeeze so the two sides come up, and then I would pull up just like that. Remove it. Remove every other one or every third one, whichever I think it's necessary. Check if it's well approximated, if the wound is, and if it is, then I can remove them all. Skin prep and apply stair strips. That's optional. I would put these in a gauze and dispose of them, and then remove gloves, wash my hands, chart what I did. That's it.